Good afternoon. Okay, quickly, 60 seconds for a hot take. At NeuroHab, we talk about movement dysfunction being the disease process. I talked about this with a patient this morning who had facet joint arthritis, which was causing some swelling and causing compression of the underlying nerve root, and therefore the patient was having radicular pain symptoms down the right leg. Movement dysfunction is the disease process that causes the observed clinical symptoms and structural symptoms. So the structural changes that are causing symptoms are also a symptom. A lot of the times the industry and therapists get this fundamentally incorrect. They will say that the symptoms are caused by a disc prolapse, a disc tear, or arthritis. This is incorrect because those conditions developed because of a stimulus. They do not occur de novo because of bad luck. Even in patients that say, well, I went skiing and fell over, and from that ski trip forever after I've had back pain. The movement dysfunction principle still holds true, because if that were the case, the movement dysfunction occurred during the skiing fall. They expressed movement dysfunction during the fall. On the flip side, people who say they've never had an injury like that develop the symptoms of movement dysfunction over many years through repetition of poor movement proficiency and the development of micro injuries and micro instability over time. So the end result is the same: symptoms as a consequence of the disease of movement dysfunction.